Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Joining me is Dr. Michael Fine, former Director of Health in the state of Rhode Island. Dr. Fine, I hope you had a good weekend. Thanks for joining us again today, Monday.
Good to be with you.
Okay, lots going on around the country and around the globe over the weekend. I'm going to leave out the political and the financial implications. Let's go right to the health care system. Let's start with the numbers as we always do.
Great. We've had 100,000 recoveries around the world. We have 353,000 cases reported around the world. But remember, I'm not putting much weight on cases at the moment because cases are a function of testing, and testing has been problematic around the world. We have about 35,000 reported cases in the United States. Both the number of cases in the world and the number of cases in the United States, both the rate of growth of those number of new cases has dropped in the last 24 hours. But I wonder if that's not an artifact of Sunday reporting, that they're just not reported as vigorously on Sunday. We've also seen a drop in the rate of growth of deaths around the world. We've had about 15,000 deaths around the world, unfortunately. And we've also had about 460 deaths in the United States. Very unfortunately, we're seeing a one-day drop in the rate of growth of the number of deaths, but I think that may be Sunday reporting. And finally, we have 83 reported cases in Rhode Island as of this minute, with 17 new cases over the 24 hours up to about 1 o'clock yesterday. We'll hear the new numbers at the governor's press conference at 1 this afternoon. And I'm expecting to see a growth of 17 to 20 cases because we're not doing all that much more testing, at least at the State Department of Health, than we were last week.
Let's go to Rhode Island first. Rhode Island saw really about a 330% increase from Monday to Sunday. A little faster than you had said is the worry number, growing, doubling every 5 days. Now we're seeing a pace that outpaces that. Could we get to a situation in which we see vast number of new cases on a daily basis, 100 or 200? Massachusetts seems 6 times the population, but seems to be starting to enter into that sphere.
Well, I don't see the rapid growth in the last 10 days that you do. I see a clear and consistent growth. You know, we went from a couple of cases to 10 a day, and that 10 a day was stable for a couple of days, bumped up a little bit. We haven't really seen that radical doubling. But that's the good news. The bad news is I expect that we will see a rapid increase in the number of cases, in part because the disease is spreading, and in part because we're going to do more testing. As soon as we do more testing, I expect that the number of cases will mushroom, but that's tested cases. And, you know, the challenge isn't how many cases are tested positive, but how many people are really sick. And we know that by keeping our eyes and ears out for how many people are in the hospital and how many people are in intensive care units. So far, it's only been a couple, thank goodness. And so, you know, we have the capacity in the hospitals, and we have the capacity in our ICUs to take care of the people who are that sick.
In Massachusetts, we're starting to see increased number of deaths. I believe it was a total of 5 over the weekend. Across not only the Commonwealth, but across the country and the globe, we really see that the demographic that seems to have the hardest time fighting off this virus is that 70-plus-year-old male. Higher indexing at all levels. Are we doing enough to protect them? Are we keeping family members away from them? Are we keeping grandchildren away from them?
Well, I don't think we've really formally started that process. Remember, the thing that we're not doing yet is beginning the process of putting people in isolation hospitals, which I think the governor is calling alternative care units. We haven't gotten those up and running yet, and aren't like to, as I see it, until we get testing widespread, because the battle rhythm is pretty clear. You got to get widespread testing for people who are sick. As soon as somebody tests positive, you want to move them into an isolation hospital or alternative care unit. And that's going to be what will prevent in-house transmission. And it's that transmission that was the bulk of the transmission in China. So I think that's where we're going as a state. We just got to get the testing capability first. Then we have to have isolation hospitals, or whatever we want to call them, up and ready. And then we'll move people out of their houses, which is what we're going to need to do if we're going to prevent transmission from grandchildren to grandparents and grandparents to grandchildren.
I think I'm probably talking about a step even before. Are we running a strong enough public information campaign that says keep grandchildren away from grandparents right now? Is that listen, we see it all, we read it all. I don't see that as a very significant. I find it a little bit in the narrative from public health, from government, but I'm not sure it should be maybe now move into ahead of wash your hands and stay away from people. It needs to go to the forefront of this discussion because of the number of cases in the mortality block that are now developing.
Yeah, and in fact, I haven't heard that as a specific set of messaging, and it sounds to me like it's a good idea. We may have been a little confused by the initial data set that came out of CDC that suggested that younger people were also likely to become seriously ill. And that's true if you do it by the total number of people infected and the total number of people seriously ill. And I think that number actually confused everybody, because though the total number is almost as large, 47%, the relative risk is still way greater in that group of people over 70. So if you're 70, you have a much greater risk of severe disease, of hospitalization, of needing an ICU, and of death than anybody who's younger.
Is there any data developing on why men seem to be more likely to pass as a result of contracting than women? That seems to be the data, not only in the United States, but globally.
Oh, I haven't seen that data, and I'm looking, but we're so far behind the 8-ball data-wise that, if I was going to be if I had the time and space to be studying this, that's not where I'd start. I'd start with doing repetitive, iterative community surveys, looking at how prevalent the disease is in every single location. One of the things to remember about testing is that a negative test is just a negative test for that day.
Right.
Just because you've had one negative test doesn't mean you can't get the disease. And so the challenge is to be doing serologic surveys. There are ways of checking blood to find out who's had the disease and become immune. And that's what we need to be doing iteratively, repeating that over a sample population so we can see how the disease is moving through the community. I think we may have started that a little bit. I have a rough indication of that, but I haven't seen that data, and that's the kind of data that I'm going to be looking for to help me understand how this disease is progressing. Over the weekend, there was a very useful report in the popular press, actually in The Guardian from Britain, of a small village in Italy, a village of about 32 or 3,300 called Vaux, where they tested the entire population relatively quickly. And that's where we learned that, or in that environment, 50% of the people who they tested and were positive were asymptomatic. That's how we begin to learn the population dynamics of this disease. That's what we need to start doing, and that's what I think we can learn from those.
Is that the best news we've heard, really, from the data collection world so far over the past 4 months in the spread of this, that potentially 50% are completely asymptomatic, at least within that culture?
Well, it's certainly useful news. the question is how generalizable it is. As you said, it was, I think, 87 or 88 cases out of, a small community of 32 or 3,300. How generalizable that is, we don't know yet because we haven't repeated it in other places. But it's the beginning, I think, of how you do the science that will really help us make decisions to guide policy.
Last week, obviously, the governor closed down restaurants for dining, put the limit at 25. I think she's changed the narrative down to 10 in group settings. I believe in Germany, they've cut the number to 2. Let's talk about, she closed down barbershops, hair salons, etc. this weekend. And I believe at 1 o'clock in her press conference, she's going to make announcements on those entering Rhode Island, returning to Rhode Island, even domestically, that they should self-quarantine for 12 days. Are we going fast enough? Do we need to go faster?
Well, these are good developments on the social distancing side, and good choices. The question is, what's faster when you get right down to it? And I think the what's faster really is about, sort of isolation opportunities. We've done a great job, and I think are ahead of the curve. Everybody's really rolled up their sleeves and joined in, which is fantastic. But I think the thing that will work best is the evolution of these alternative care centers, and is people's understanding about what we're doing. So when we start going there, if we do, people are ready to say, yes, I'm going to go in for 14 days. It's 14 days, not 12. But yes, it's okay. And if you want me to go and spend 14 days in, this other place, I'm going to leave my house and do it. We're a very deeply community culture. We really are tied to family and home. And I think we need to be preparing people for making that change, because when it comes, I think it will be different for most people. And that's why it's worth us talking about it. And that's why I think it's worth people around the state talking about it, so that they're ready when that moment comes.
Doctor, where do we go next? What should we anticipate? What's the most likely scenario based on what you know today? And how do we physically adapt to it, and how do we mentally adapt to it?
Well, I think we've got to think about the short term, but also the medium and long term. We don't have any immune protection against this disease. So right now, all of us are eventually going to get the disease, and that's the thing we have to prepare ourselves for, remembering that, the only thing to fear is fear itself, and this is a mild disease for most people, and it appears it may be totally asymptomatic in as many as half of us, or perhaps more. We don't know yet.
Right.
So in the short term, we want to prepare for surviving mentally and emotionally through this period of isolation. Then we want to prepare for some opening, but understanding that as we open, there will be pockets of outbreaks. And in those pockets of outbreaks, we may have to clamp things down again. So, I would expect what I'd call a sputtering course, where we do well for a while, then we get bad again for a while and close down, or close down partially, then we open up again, until either we get a vaccine, or until we have good documentation that 60 to 70 or 80% of the population has been infected and is immune. Because at that point, and we don't know exactly what the number is, but at that point, we believe we'll get herd immunity, and the virus won't spread when it breaks out.
That was my next question. If we see this pattern and we assume some significant proportion of the population is asymptomatic, whether it's 40 or 60, doesn't really matter. Does this help us not repeat this exact same thing come the fall? And that's, by the way, we're assuming that the summer months are going to give us some relief.
Well, come the fall, I would like to think that we have the infrastructure in place, which is what we lack now. That we have the ability to test, and the ability to do contact tracing. And I mean, we're doing it now, but I worry that the numbers may soon overwhelm our ability to do that. So we do contact tracing. We know how we have places to send people for isolation. That's the kind of thing that we don't have yet, that we should have in place by summer, and that will help protect us and help us function during the fall until either a vaccine arrives or the great bulk of the population has gotten the disease and become immune.
A week from now, what kind of numbers do you think you anticipate we're talking about?
I would guess that we're going to be looking at 40 to 50 new cases a day. And I would bet that we will then have, 10 to 50 people in the hospital at any point. And that's containable. A week or two is going to be like this week, only a little more. 6 weeks from now and 8 weeks from now is when I think we'll really see the height of this. And that will be very different. We'll have lots of people in the hospital. And everybody needs to kind of cluster around and support the healthcare workers who are taking care of them, because they're going to be working harder than they've ever worked in their whole lives.
The reports back already are that frontline healthcare workers are working to a level of exhaustion in certain areas of the country, New York, state of Washington, etc. That's not sustainable. Is that the National Guard giving relief? I mean, are we training a workforce over the next 10 weeks? What do we do for those ER doctors to be able to not burn them out and not lose them to this disease?
Well, this is kind of everybody stepping up. I'm hoping that we will really, I've seen evidence that we're already thoughtful about workforce solutions. The Department of Health yesterday announced a special process of licensing.
Right.
Our health professionals are here, but don't speak that much English or don't speak English well enough to be licensed previously. That's an important source. I'm hoping that we will use the Medical Reserve Corps and other avenues to really bring together all the resources we have, all the nursing, medical, respiratory therapy resources we have, so that we can take turns, so that we all go in and help for a while, and we do this together. I think that's going to be the only way to get through it. And just like logistics is important, I wrote a colleague an email this morning saying that I think workforce is critically important, and we need to be really focused on it, because the difference between us and Wuhan, China. When Wuhan got into trouble, they brought in 42,000 healthcare workers from around China. There are not going to be 42,000 spare healthcare workers in the United States, because all the people in Washington and New York and New Jersey, they're all going to be working in Washington, New York, and New Jersey.
Right.
The thing China was able to do was to contain it in one place. We're past that, and we need to really be developing our own workforce so we are, sort of keyed up, ready to go, extra trained, know what we're going to do, know where we're supposed to go and what time we're supposed to be there, so we can all roll up our sleeves together. And
there's got to be a bastion of affluent retired physicians living out on Block Island year-round that we can tap into. And I'm not sure that can solve our 42,000 need, but that's got to get us 3 or 4 more.
And I would argue that nurses are, in many ways, way more important than doctors right now. And there are have been traditionally lots of nurses who are licensed but aren't using their licenses. They're working as real estate agents and other sorts of things. We need them now.
Yeah. Dr. Fine, thank you. We may even touch back later today. For everyone watching, stay tuned for Governor Raimondo's 1 p.m. press conference. I believe she hinted yesterday that she'll be announcing some significant restrictions on those returning into the state. As we know, Connecticut, New York, and New Jersey in the region have already called for shutdowns in their states. Rhode Island and Massachusetts may be next accordingly. There's 83 reported cases. Before the 1 p.m. press conference, we'll be looking to see what those numbers look like. And unfortunately, continue to see an increase in the number of those filing for unemployment or temporary disability insurance. Those numbers are not coming out today as of yet. Those may be pushed off till tomorrow. Hopefully we'll get some new numbers on that, and maybe that trend can stop at some point. It's going to be a long, hard ride for all of us in Rhode Island. I do want to say I was out a number of times walking yesterday. I thought how people dealt with it was spectacular. It was great to see kind of Rhode Islanders responding across in Providence, across the city. Thank everybody for tuning in. Stay tuned for Governor Raimondo at 1 o'clock. Dr. Michael Fine, thanks so much.
Thanks, Josh.